Welcome to everyone to Democracy Winners, and thanks for joining us today. And my name is Kate Laddish, and I'm a member of DW Steering Committee and am today's facilitator. And before I introduce our speaker, I'll give a quick overview of our group. So we're founded about 6 years ago here in Winters, California in Yolo County. And so Democracy Winners is a nonpartisan organization dedicated to strengthening democracy, protecting constitutional freedoms, and promoting informed engagement in local, state, and national politics. And our weekly newsletter includes previews of meetings such as this morning's. And sorry, I'm trying to multitask there. So our newsletter has the previews of meetings as well as a call of the week, opportunities for civic engagement, and more. And while most of our members are from Yolo and Solano counties, we have members from farther afield as well, including Sacramento and the Bay Area and into the foothills. So if you'd like to join our newsletter list to get notifications of meetings such as this morning's, you can send me a Zoom chat with your email address or email us at info@democracywinters.org. And the first hour of our meetings feature guest speakers. And then after that, we hear from our federal, state, and local issues trackers. And we'll close with a few minutes of pop-up announcements from members and then wrap up by noon. And so now it is very much my pleasure to introduce Sacramento-based journalist Angela Hart of California Healthline and HealthNews. Angela's reporting focuses on healthcare politics and policy in California and the West, with a focus on Governor Gavin Newsom, government accountability, and political influence. And she's won awards for her work on homelessness, public health, and the COVID-19 pandemic. And before joining California Healthline and HealthNews, Angela worked for Politico and the Sacramento-based. And this morning, Angela will focus on the politics of healthcare in California, covering a wealth of topics. And she'll give the approximately 30 to 40-minute presentation, followed by Q&A. And I'd like to thank Martin Coos and Emily Bazar, who are here today, for connecting us with Emily. We really appreciate it. Connecting us with Angela. And Angela, the floor is yours.
Good morning, everyone. Thank you for the lively discussion that's about to happen and for your participation this morning. I was just telling Kate, I tend to ramble, so if I'm talking too fast or if there's just anything you guys want me to elaborate on, feel free to pop in and ask more questions in detail later on. I just want to start out, we're going to talk about health policy and politics in California. There's a lot going on. I would argue California is where it's at on healthcare in the entire country right now, especially under Governor Newsom. But I want to set the stage a little bit and really take us back to when he took office in 2019. This is a governor who ran a very contentious primary campaign, if you guys recall, with a challenger, Antonio Villaraigosa. That was in the June 2018 primary. But that really led to an important healthcare dynamic that is still present today. That's single payer healthcare. This idea that you get rid of insurance companies and you really try to streamline healthcare and transform the system in ways that are to some unimaginable. That really framed Gavin Newsom as the healthcare governor. In fact, he told the California Medical Association in 2019 that he wanted to be California's only healthcare governor. Really kind of, I think what I read there and what I think he was saying there is he really wants to shake things up. And he's done that in a lot of ways. There's a lot of ambitious initiatives that he is leading and that he really has kind of forced the legislature to come along with him on. There's a lot, however, if you scratch a little bit beneath the surface, there's a lot that's being promised and discussed publicly, and when you look a little bit further, there's really not a whole lot of follow through yet. And I think this administration really needs to be held accountable when it comes to implementation and really following how some of these ambitious healthcare policies are really working on the ground for regular people. So that's kind of just, I wanted to shape the discussion in that way. Single payer is a sexy, democratic firebrand kind of wish, dates back decades. Governor Jerry Brown ran for president on single payer back in the day. And it's just a really, it's like I said, it's a really sexy campaign slogan for the liberal activist party of the Democratic Party, it becomes more difficult when you actually start to think about how that could work in Sacramento. And I think, so Governor Newsom, while promising to lead on single payer and push a bill to begin to implement this system, has really backed away from that promise in the legislature, or as the legislature has proposed bills. What we've seen behind the scenes over the past 4 years is him really pushing back. And instead, he's done, I just want to talk about like 3 kind of buckets. He's done really 3 areas that really try to like implement very substantial reforms of the healthcare system. And even I would say taking the healthcare system further than healthcare into the social services realm, in a bigger way than anywhere else in the country. So in a way, he's tried to sort of back off of this big promise he made and temper expectations and say, but look, you know, single payer is really about universal healthcare, expanding coverage to everybody. We're going to do that. Single payer is really about transforming our payment systems and transforming the way the system works for people. We're going to do that. So I think where we've seen him, I won't say much more about single payer, but I would just make the point that I think what we've seen is him temper expectations and distance himself in a way that is, as he likes to, his administration likes to talk about it, pragmatic. They like to say there's one thing, campaigning is one thing, governing is another. And when you actually get into office, there's some cold realities that really start to hit the fan. And I think we've seen that in his policies. Newsom took office in January of 2019, promising really big stuff on healthcare. I mean, going back to his healthcare governor, you know, label, he really came out and is in an executive order against tackling high prescription drug costs, on really kind of reframing homelessness as the healthcare issue that it is. And of course, on expansions and expanding the systems of care, but also expanding the health insurance industry. We've seen that in his first year. I'll take that expansion of the system. He did so. It's sort of evolved, but out the gate, this was under former President Trump. We saw him re-implement or pass a California individual health insurance mandate after the federal government zeroed out the tax penalty, if you guys recall that. That came along with some new money, some state money to boost subsidies for Covered California, the state health insurance exchange. This was a big deal because California was really kind of putting up its fist to the federal government and to Trump, who was like really railing against the Affordable Care Act at the time. And in a way, it helped frame the governor's stance on where he was going to take the system, right? Fortifying the system rather than taking it on, I would say. Then there was a lot of, I covered you know, these battles pretty closely, and was, you know, running up and down the halls in the Capitol trying to figure out what was happening with the Medi-Cal expansions to undocumented immigrants in California. This has been a dream of not only the immigrant community, but healthcare advocates in California since, I mean, even before the ACA, but since Obamacare took effect. This has really seen as like the next big fight in California. Single payer, to them, yes, it's laudable. Yes, they want it, but they see it as pie in the sky. Expanding coverage to such a large segment of Californians, people who live in California, was a major goal. And Newsom really pushed back on that initially, really talking about we didn't have enough funding. And just want to fast forward, it took a major legislative effort, really led by Senator Maria Elano Durazo from Los Angeles. She really, and Senator Wiener was really a thorn in the side, I think, of the administration here too. They really pushed the governor, and over the past I don't think the first year there was an expansion to Medi-Cal. I think it started in 2020 was the first expansion to another segment. So starting in a year or two, where California is now full expansion. So every undocumented immigrant in California will be eligible for Medi-Cal. I would note that the governor does talk a lot about this as being, a major notch in achieving universal healthcare. He's fundraising on it, putting campaign emails out on it. California is the first state in the country that has universal healthcare. Not so fast. There isn't in reality a universal healthcare system in California. What to give the governor credit, there has been major expansions of coverage. But there are many, undocumented immigrants, for example, who aren't eligible for Medi-Cal, who cannot buy health insurance on Covered California, for example. There are many others who simply can't afford the care. So, and there's a lot of people still going uninsured. We did a article in the past couple weeks, really looking at what has happened to the health insurance mandate since it was passed, and we found that 400,000 Californians in the first year of that penalty, 2020, went uninsured and paid the penalty. And the government is Newsom is resisting efforts to spend that money. It's really sitting on that money for a rainy day in the future. So I bring this idea of universal healthcare and the expansions underway, as there is really a tremendous policy change that has happened, but it's not as much as being promised by state leaders. And I think for me, I think I feel a responsibility to really talk about where that coverage is falling short and where the government's promises are falling short, and how that really affects Californians who can't afford coverage. This is almost a cliche at this point. You can't afford, you pay for healthcare, or you choose to pay your rent or forego groceries. It's so repeated by state lawmakers and by advocates. But if you really start to talk to people who have Medi-Cal and people who can't afford coverage, and you really try to just understand where the system is falling short, that's like a reality. And that's even in my, when I put articles together, try to stay away from cliches like that, but it's a truism. And it's become really clear as I talk to people, not just from reporting, but just in everyday life, that there are tough things happening right now with the skyrocketing cost of healthcare, out-of-pocket healthcare costs, premiums. I talked to someone the other day who was going out of his insurance network for behavioral health care because the mental health care that was provided by his provider wasn't adequate. So there's a lot of ways where the system is failing right now, and we don't hear the governor really talking about that so much. So that's one thing. I want to switch over to the next kind of bucket, which is really looking at something I'm really excited about, which is breaking the state Medicaid system called Medi-Cal in California into the social services realm. California really launched this extraordinarily ambitious initiative. It started in 2019. Actually, it sort of predated Gavin. Top state Medicaid officials were kind of working on these experiments prior to his administration to deliver things like healthy fresh fruits and vegetables to Medi-Cal members, to help people get into housing, not just paying for first and last month's rent, for example, but to negotiate with landlords. Hey, we have a person who can't find an apartment. Will you accept them? And doing that on the ground, nitty-gritty negotiating. Seems kind of wonky and boring, but that is such a key for so many people who can't find housing. Anybody who's a renter, you know how hard it is for you. Imagine working 2-3 jobs and trying to figure that out. Imagine being homeless and trying to do that. There's so much disparity and discrimination in that system. So there was all these little experiments happening. Newsom came into office and really took this and he ran with it. This initiative, one of them I'm talking about, is called CalAIM, California Advancing and Innovating Medi-Cal. And this has now grown to a nearly $9 billion state initiative that will be unveiled and rolled out over 5 years. We're heading into the second year of implementation in 2023. So this first year is the first year we've seen any kind of implementation, and this is a big, giant 5-year initiative that the state had to essentially apply for permission from the federal government. The Biden administration signed off. And it really is giving the state permission to do things outside of healthcare. like I said, to buy Medi-Cal members fresh fruits and vegetables. It puts the onus on the managed care plans that serve Medi-Cal. There's 25 in California, so it requires them to offer some of these services to people. There's another benefit, asthma remediation. So if someone's got asthma and they're going to the emergency room, their kids are in the ER month in, month out, the state will send someone in, the health plan will send someone in to look at, oh, what's triggering your asthma? Let's give you a new carpet. Let's change out your air conditioner. Let's look at mold in your home, black mold that could be triggering asthma. It's a major trigger, cockroach infestations. So really addressing substandard housing is a big deal of that initiative as well. There's a number of others, including trying to keep people out of emergency rooms, out of costly mental health crisis centers, out of jail, by really providing social services upstream, if you will. And there's another benefit that goes along with it, really targeting homelessness. And this is another way that Medi-Cal is really, I think, pushing the bounds of any Medicaid program in the country. It's really targeting the state's homeless population, about 160,000. That's a very low estimate. That's the latest number, but we all know it's bigger than that. And it's really kind of going out into these encampments that you see everywhere and not just saying, what do you need right now, but will you sign up for Medi-Cal? What can we do to provide some stability for you? Can we find housing for you? And so the state is actually, putting together this whole apparatus, this whole government apparatus to try to bring homeless individuals off the streets and into housing. And I just think it's a really big deal that a state like California is looking at homelessness as a healthcare crisis. There's so many challenges there, and I'll talk about that in a little bit. There's major trust problems. I mean, you can imagine if you're homeless and you've been in and out of jail, or you've been perhaps institutionalized, or you've been in and out of foster care as a kid, you can imagine, there's a lot of mistrust in government. And I think that's one major peril that the state is really encountering this year in the first year of implementation of this big program. They're really having a hard time trying to reach people and find early success. Homeless people were one of the first sort of target populations. Next year, this is going to expand to other populations, including the incarcerated population as they leave jail, foster kids. I think that starts in July 1 of next year. Anybody with a behavioral health condition, people who are at risk of falling into homelessness. There's a number of target populations. I'm happy to say more about that. There's so many interesting and exciting things that are going on with it. There's also really a lot of challenges. The state has really put the onus on health insurance companies to make this happen. And there is reluctance. It's not mandated, but the state is heavily saying, if you want to do business in California, you've got to start offering this stuff. So what we're seeing now is these public and private health insurance companies scramble to pay for stuff, new stuff, to, reach members and people who could be, new members, to build that trust that's going to be so essential. And there's a lot of broken promises already that we're seeing on the ground. I mean, I just talked to a woman the other day who is pretty sophisticated. She didn't have a lot of challenges, but she definitely was eligible for there's a lot of new supports that are available for elderly people in Medi-Cal, otherwise known as Medi-Medis, the Medi-Cal Medicare population. And it was going to take 8 months to even get a consultation for going basically into a post-acute hospitalization, and to keep them out of skilled nursing homes, which are very expensive. So there's a lot of failures that are already happening. I think the state's trying, and they have defended themselves pretty voraciously, saying, listen, this is something that we're going to build over time. We're learning. This is an iterative process. So I'll leave one more thing on the CalAIM initiative. This is really looking at, I think there's two overarching goals that the state's really driving towards. Number one is improving health outcomes, of course, but tied to that is saving the state money. The healthcare cost trajectory is soaring. It's rising faster than inflation. That's true across the country. It's especially true in California, as the state has added new benefits and new populations to the system. So the healthcare cost curve is extremely unsustainable. The governor talks about that a lot. I can hear him in my head saying, healthcare is the budget. Healthcare is the budget. He's like very concerned about the healthcare system gobbling up more and more of state discretionary money, and it could cause real problems in the future. So they're taking major steps right now to really try to lower that cost trajectory for some of the most costly patients in California, and Medicaid members and those who don't, who are eligible but not currently in the system. What can we do to save money by providing benefits upstream? That's a really exciting part. There's a lot of other stuff going on in Medi-Cal. The state for the first time this year is forcing Medi-Cal plans to essentially reapply for their job. There's a lot of strict quality mandates that sort of have been skirted, and if you guys know, Medi-Cal is not a high quality system for everybody. Not everybody can access it. There are major barriers, there are major shortfalls. So the state's trying to sort of put some teeth back into its regulatory demands, and it's trying to also address some equity, some problems with disparities. My colleague Bernard's been covering a lot of that. It's very interesting to see sort of this jockeying between public health plans and private insurance plans, both serve Medi-Cal, to really say we are best poised to do business in California. It's a very wonky term called reprocurement. This just launched earlier this year, and we immediately saw a rush of lawsuits from some of the plans who basically applied, and the state said, no, we're not going to let you serve Medi-Cal anymore. So all of this is sort of in limbo. There's lawsuits and the state's improvements that it's driving at. It's unclear to me how those legal challenges are going to delay some of this transformation. But that's all to say, within that Medi-Cal realm, there is a giant transformation going on, and it's not overstating it to say that this is the biggest change that's happening in Medicaid in the entire country. I mean, it's like on crack compared to what other states are doing. I want to move on briefly to, I just want to mention on behavioral health. The behavioral health is the overall umbrella term that tackles mental health conditions as well as substance abuse disorders. The opioid crisis is raging. There's so much fentanyl on the streets. I've seen it. It's so cheap. It's like $5 a pill, and it's everywhere. It's impacting every socioeconomic group, and homeless people it's just like the state is trying to do a lot to address addiction disorders and to address the opioid crisis and to address the major shortfalls that there are in mental health care in California. This is really new. There's a waiver essentially state asking the Biden administration for permission to do some new stuff here. I just kind of want to bring that up to, watch that space. There's a lot that the state wants to do in terms of improving the facilities to serve people. That's very new and it's in its infancy, but the state's trying to do more on that. In the CalAIM initiative, there's some other big changes to, for example, allow people to start getting treatment before you have a diagnosis. It might seem like a small deal, but it's kind of a big deal if you think about it. If you have to, if you're in crisis and you need medication, for example, you can imagine if you have to go through all the rigmarole of getting a diagnosis, getting an appointment, waiting for a specialist, blah, blah, blah. You can see how that might create barriers to care. So the state's already doing some little stuff around improvements, but that is another area that is really important, not only to Governor Newsom, but Secretary Mark Galley. He heads the State Health and Human Services Agency. It's almost why he came to California, he has told me, to really drive at the shortfalls in behavioral health, and especially for kids. There is $4.4 billion that the state will be starting to spend next year to launch this kids behavioral health initiative in schools. We've seen since the pandemic that there's dramatic and life-threatening changes that are happening for youth in terms of suicidality and mental health condition, anxiety disorders. There's so many undiagnosed and there's such a crisis of care that's coming down the pike there. And so the state's trying to sort of address it. it's falling a little short in my estimation if you talk to advocates and if you talk to people on the ground. Some of it is really just behavioral health, right? Connecting kids with like a 10-minute psychiatrist visit or putting a mental health therapist in schools. That's not available in all schools yet, even where it's most needed, especially in the lower income districts. And I'm just a little skeptical on you have to form a relationship with a mental health provider. So I'm a little skeptical on doing this virtually and how that's going to work in the schools. This is really in its infancy as well, but I wanted to mention it. A couple of other really exciting things that are going on for me in the reporter realm. Exciting, I mean, California, this is one of the big things that Newsom came out promising, and we're starting to see a little bit of teeth now being put in on really trying to take on the pharmaceutical industry and lower prescription drug costs. Newsom kind of had just rhetorically promised this when he first took office, but this past year we've seen him really shape his idea, which is to produce a generic drug label for California. This would be called CalRx, complete with branding with the California Golden Bear, for example. You'd be able, the idea that the state has put $100 million into this already. The idea is you'd be able to go to a Costco. They announced a new Costco partnership for Medi-Cal a couple weeks ago. So I'm just putting the pieces together a little. You could go to a Costco, you could go to a CVS, you could go to any retail pharmacy, or even perhaps like a grocery store, to buy this new generic drug label in California. This is a really big, ambitious idea. There's a lot of, if you, again, scratch beneath the surface a little bit, the state is negotiating with these extraordinarily deep-pocketed drug companies. And there's a lot of resistance I have found in my reporting early on to saying, look, we want to help, but why would we do business in California when we have our own, they have their own business models that the state essentially is competing with, or is going to be competing with. So it wants to sort of initially contract with an existing generic drug maker. And then eventually the state wants to get into its own drug making business and start producing its own drugs. Which drugs? The state is promised to start with insulin, given the extraordinarily cost that's been, compiling over and over again. The profit markup on insulin is bonkers, and so the state wants to really go after that. Initially, there's one company called Civica RX. They're based in Utah. They started making generic insulin last year. And they have been in the generic drug making business for years of decades. And they have had negotiations with the governor's office. The Newsom administration won't say if that's who's going to be the contractor, but I put my money on that it is. And Civica is very excited about what's happening in California. Again, if you look at the government to private business negotiations, there's a lot of details that are still being worked out, but we should watch and maybe towards the end of this year or early next year to see some new partnerships being announced and really trying to break into this space. Which other drugs? That's an important question I've really pushed the administration on. They're talking about drugs that, there's kind of two categories: high-priced boutique drugs. If you guys remember, like the EpiPen markup from that got a lot of headlines a few years ago with Farmer Bro, quote unquote. That's kind of one idea that they want to go after, but they also want to target drugs that are high cost but used by a lot of people. So they brought administration people talk to me about cancer drugs, for example, or what is that condition? There's another arthritic condition that's escaping me at the moment, but you get the point. Targeting costly drugs in a number of used by a lot of Californians, but also those that are subject to market manipulation. So that's an exciting space. No other state, no other government institution has ever tried to really take on the pharmaceutical industry. So there's a lot of behind the scenes, there's a lot of mumbling and fear and, opposition against this, but the Newsom administration isn't backing down, and they frankly welcome that. They want the fight. They want the public fight, and it looks good for politics. Two more things and then we can go to questions. I just want to talk, we're still in the COVID-19 pandemic. California, it was a leader in being the first state to shut down. Newsom really led that, and that's fair. He did follow a lot of counties that were pushing him to lock down sooner. So we saw Bay Area counties, for example, take more aggressive actions to curb the public health crisis early on in 2020. What I want to say about public health is I know people are exhausted, but this is continuing as a major crisis. And despite California's early leadership, it has fallen, I would argue it has fallen to the wayside. The leadership is virtually non-existent. I mean, I went to talk to the governor last night for a press event and nobody was wearing masks. And including Secretary Mark Galley, the state's health and human, I mean, just like the masking, the vaccine rates for California are paltry. They're under 20% for statewide. If you look at the Medi-Cal population, it's even worse. That's a population the state has direct responsibility for. So I think there's just kind of a tale of two cities type of thing with the public health crisis. Yes, the state believes in vaccines and is pushing and marketing. And yes, the state has been aggressive, but not in all areas. And I think that's extremely important to point out. Governor Newsom likes to point the finger at Ron DeSantis in Florida and Greg Abbott in Texas, saying, look at their horrible death rates. But, there's a lot of Floridas in California. There's a lot of Texases in California. If you look at the Central Valley, those vaccination rates are lower than those states. So I think there is an argument to turn the mirror on the governor and say, look in your own, state for what you could do better, instead of sort of looking at the political landscape and pointing the finger. The state needs to do better. We did, in my reporting, I have pushed really aggressively on the governor to answer to the major shortfalls in funding for public health. This has been a persistent issue. The state public health department was formed in, oh my God, I'm sorry, I should have wrote this down. I think it was 1999, but now it's escaping me. It might've been 2007. But essentially, since California public health has always been underfunded, it's weirdly tied to vehicle license fees. Isn't that weird? Like, that doesn't make any sense. It also has to fight, that funding is also a pot that pays for behavioral health, which isn't that weird? Like, you can understand the shortfalls in both areas. So as a result of our reporting, the state did this year put up some ongoing funding for public health. This has been a request from the state public health, from the county local public health directors for decades. They have been begging. So California has 61 public health officers, and they've really been trying to sound the alarm bell on the shortfalls in funding for years. And finally, it took the pandemic, but finally the governor did grant ongoing funding. $300 million a year started flowing this year. It's supposed to be annual ongoing. So that should fortify some public health infrastructure. Think about labs that are required for testing specimens. Think about staffing. There's this new testing of viruses and wastewater treatment centers. So pushing vaccines, really cool, interesting vaccine campaigns. There's one county that's has gosh, I think they're old school now, but the newspaper dispensers, they have those where you can just put not even money, you just put in your zip code or something, and then it gives you a free COVID test. I think that's in El Dorado County. So there's really cool, interesting stuff that's starting to be done with that money. Okay, so that's public health. I have a lot more to say on that. So if anybody has any questions, just let me know. That's a big area that we're going to continue to be following. And then lastly, I just want to bring up abortion. And this is, of course, a major healthcare issue for women, families in California. California is the leader, Prop 1, the measure to enshrine abortion and birth control protections in the state constitution, passed by a wide margin. God, this month, that's crazy. Feels like so long ago. And of course, the state put in millions of dollars in funding for bolstering clinics that offer abortions, really to tell the rest of it. And Newsom has said this verbatim: women who can't get access in other parts, come to California. We are your safe haven. Senate Pro Tem President Tony Atkins and the Prop 1 party on election night literally said, California is your safe haven. Please come here if you need help. So California really is the leader on abortion right protections and on reproductive rights. Nobody is shying away from that, including the Attorney General. He has promised to rebuff any challenge to this and really put up a strong legal fight to preserve what California has and even expand it. I think we can look at to see more funding coming for reproductive care in the future budgets. There's a lot of people in the legislature that are pushing for that. Let me think. There was one more point I was going to make on the abortion care. I just think that that's the real impact on people. I think we also can't divorce the reality of California enshrining abortion protections from the politics of it. And it looks good for Gavin Newsom. This is a person who likes to be out front, who has reaped the benefits of being first. Think about the gay marriage, taking on his own party to allow gay marriages when he was mayor of San Francisco. He passed a universal healthcare program in San Francisco offering coverage to care to undocumented immigrants before it was wildly unpopular at that time within his own party. I mean, he has really been in some ways unafraid to buck his own party and really, yes, grab a headline, but also try to look at what's coming and be ahead of it. And I think with abortion, he has really owned this. He campaign fundraises on it. He raises money for the party on this. He's helping other states. He's going after states. I mean, he really believes in his heart that, states that are rolling back abortion protections and reproductive rights. I really believe in his heart. He thinks, he has a vile feeling against them, and he makes no bones about that. So I just think that this is something we should watch as he does shape his national image and as he becomes increasingly attractive as a potential presidential candidate. So the abortion issue is a big deal in reality. It's also a big deal politically. And I think we should watch Newsom try to push this space even more because he is out front often on a lot of stuff. There's two more things I'll bring up. The state is, I just made these little add-ons. The state's doing some other stuff on trying to curb healthcare costs through this new office. It's trying to set a curb on the soaring costs for it's called the Office of Healthcare Affordability. Basically, instead of cutting costs, it tries to slow the cost growth curve by putting limits on hospitals and insurance providers. That's really new. I just want to put that out there that's like something really a big deal that we're going to be watching. And I'll leave it at that. It's 11:10. I think I'm time. So open up for questions.
Oh, that was perfect. So thank you so much, Angela. This was great. So yeah, so we'll go to questions and John, go ahead.
You're muted, John.
Thank you, Angela. I really love your work. You're the only reporter I know who followed the Healthy California Commission.
Oh, thank you.
You actually paid attention to what they were doing. I think that was a sideshow to take the single payer activists and distract them so that we didn't run somebody else for governor against him.
I agree with you.
I know, and you've done a great job of implying that many times in your reporting. You've done a great job of questioning the authenticity of Gavin's claims. So first off, I want to point out that May Revise was invented in the budget process because of the Medi-Cal budget. Healthcare has always been a crisis. In the Reagan administration in May, they said, we've got to know how much Medi-Cal is over budget for next year's budget before we can do next year's budget. That's how crucial it's always been.
Wow.
Number two, we're in an endemic. We're not in a pandemic anymore. If Biden had known that, that's my one criticism of Fauci. If Biden had called it an endemic instead of a pandemic, he said the pandemic's over. The pandemic's over, but we're in an endemic and it's always going to be here. We've got to learn to live with it. The CalAIM is really an attempt to bureaucratize the integration. I encourage you to look at the state of Oregon, particularly CCO 2.0. I think is And that's the system they have now. They know where all their Medi-Cal, Medicaid recipients are in Oregon, and we don't in California by a long shot. So
Oh, thank you for that.
I think Oregon is actually much better organized. So they have a new universal plan that's actually much better than the report that the Healthy California Commission did. Washington just did a plan, and theirs is very status quo, incremental change. I love the fact that, I'm sorry, this is no question, but I love the fact that you distinguish between single payer and universal care. We're closer to universal care because of Obamacare, but the problem is that it's much more complicated. And the healthcare providers are living in a very bad world because the insurance industry is running what they're doing in the clinic, and they're spending half their time on the computer and a quarter of their time with patients.
Yeah.
And that's the biggest consequences of Obamacare and the health insurance industry. As long as we don't have single payer, we are not going to have a good healthcare system. And it's worse for the providers than the health professionals than it is for the people. The last thing I want to say is I was a county mental health administrator. Care Court is a complete fraud. With most of the counties not providing good behavioral health, how can the Care Court work? So when there are 5,000 people that should be in the Care Court and they help 100 of them, that's not doing anything. Thank you for your talk and your work.
Thank you
Oh.
so much for those points too.
I'm the national newsletter for the League of Women Voters on Healthcare, and I would like to send you that. Can I get your email?
Yeah, please do. It's just my first name, Angela, my last initial H, Angela H at kff.org.
Thank you.
Great. John, thanks so much. And Ken.
Yeah, great. Thanks for a great talk. And also thanks for the bird print behind your head.
Oh.
A little distracting, but very, very amusing. Anyway, really deep and high bandwidth there. So thank you. Question, I want you to go a little deeper on the resistance that Newsom and especially via the legislature. And what I worry about, I'm a longtime socialist / communist, is that the immense power that the health industry and the hospital chains have over politicians. And I think nothing about a rant here, but nothing really meaningful about cost control can happen until that death grip on the politics is broken. So I want you, because you're in that politics, I want you to comment on whether there's anything we as citizens can do, or as healthcare consumers can do, or that you as anyone can do to break that really diabolical grip that huge money has on Sacramento.
Gosh, that's a good question. I don't have a magical answer. I think it would take magic to break that. It's so enshrined in our politics. But honestly, we're doing what you guys are doing, raising awareness, being civically engaged, participating in the electoral process, participating in state government, public comments, these things sometimes seem like they're rushed through, but writing lawmakers and voicing, talking to your representative, that stuff really matters. It's different for us. I think reporters have a responsibility here to shine light on those relationships, those financial connections, and those dark politics, frankly. Even if take the Office of Healthcare Affordability, for example, my colleague Samantha Young and I, we reported last year on the initial goal of this whole thing was to cap the revenue and profits that the industry players were bringing in. This went down right as the pandemic hit in a fiery pit of death, like amid intense lobbying by the insurance companies, by companies like Blue Shield and KP vehemently opposed it. We saw the California Medical Association bring up their top brass and, very close with the governor. So really leaning on these relationships. These are all not only the big, deep-pocketed, powerful lobbying groups, but close and well-funded donors to the governor's campaigns. So like breaking, it's a laudable thing to think about. And, that's not for, that's not my job. My job is, I just think that we have a responsibility as reporters to point out the sort of sausage making behind policy and the political bedfellows that happen, and show that if there are, if there is an exchange of money or interests and competing interests and policy as a result gets watered down, we have a responsibility to point that out and cover it as such. So I think that's what we can do. And for everybody else, yeah, fight the good fight.
I have to say that's not really encouraging, but thank
Yeah,
you.
sorry about that.
Ken, you're a resident optimist. What do you mean it's not encouraging? Actually, I'm all fired up now, Yeah, informed engagement. All right. So,
All right, let's go. Let's go.
so, all right, Jim.
Hi, thank you for your talk. It's great. You sort of briefly hinted upon two subjects, preventive medicine and addiction. Just as background, I'm a retired family physician. In my 40 years of practice, the various situations I've been, I was a commissioned officer in the Indian Health Service.
Cool.
I had 5 or 6 years of old time private practice before the HMOs hit the market. HMOs hit the market, we got into corporate medicine. Then for my last 17 years, I was in a federally qualified rural health clinic in Colusa. And Colusa County had 1 psychiatrist for the entire county. I don't think there was a physical therapist. My point is,
I'd love to get your phone number.
well, because I am a strong supporter of universal health care, because if we don't get going with preventive health, we're not going to get anywhere in terms of cost. When you're working in a fee-for-service situation, I'll make more money, or I would have made more money if my patients were sicker and they had to be in the hospital, because I would be busy and I could charge all kinds of money. But nobody's paying for preventive health care and worrying about the social determinants of healthcare, as you kind of touched upon as well.
Yeah.
A good example is diabetes. If we could do preventive health care so that type 2 diabetes didn't get out of control and everybody went into renal failure, then it would be interesting to see how much money the dialysis companies pay the politicians to discourage funding for preventive health care. Because if we could control diabetes better, we wouldn't need the dialysis so much, and they wouldn't make so much money. That's just one example, but I'm sure there's many other examples out there where you make money off of sick people. My guess is that if we could work on preventive medicine, it will cost us more for a few years before we start seeing the benefits of controlling the social determinants of health. And the same with addiction. If my opinion is that drug addiction is a medical condition, and if we started treating it as a medical condition rather than putting people in jail and realizing that it's going to take several years, not 90 days, to detox people and assume they're cured, that we won't make much progress. So I'm a strong proponent of medically assisted treatment or medication assisted treatment to help these people who suffer from addiction. And fentanyl, when it first came out, it was excellent pain control when it's given appropriately. And, it's unfortunate that it's on the street now, people are dying. But anyway, it's where the money is. And the people who are profiting off of sick people, that's what's causing the trouble as far as I'm concerned. And we need to invest in preventive medicine. Thanks.
James, you really hit the heart of something that it's increasingly, I'm aware of it, and it's in my consciousness more and more as a reporter. And this really gets, I hate to say it this way, but it really does come to payment, the idea of adequate preventive care. I did a piece earlier this year, really looking at spotlighting some of these problems and how they show up in the hospital down in South Los Angeles. My goal was to go down there and look at CalAIM and how the hospital was a contractor to provide some of these CalAIM services, social services, right, to get at the social determinants. But it's not only about social determinants. It also has to do with getting adequate regular care, as you mentioned, preventive care, primary care. I went to that emergency room and I spent 3 days down there in the ER with it was unprecedented. I mean, they let me go wherever I wanted. It's unprecedented it's very hard to get that kind of access for a hospital. And I also got to go to their behavioral health crisis ER. And gosh, I just saw hit me in my face everything that you just talked about. I mean, people coming in who were waiting 6, 8, 12 months to try to get a specialty or primary care appointment. People, the medical illiteracy, people not knowing like what their health insurance was. So they always, you know, their dad always went to the emergency room at MLK. So they went to the emergency. They didn't you know, people who grew up like especially poor don't like, I grew up this way too, going to the emergency room for healthcare. I never knew what primary care was. So you saw that people coming in with advanced diseases, limb amputations because of advanced diabetes. That hospital actually fundraised to build a diabetic amputee clinic to try to save limbs because they saw so many people coming in. Advanced liver disease, advanced kidney disease, people coming in without having their bipolar medication for days. I mean, that is really dangerous. So like everything that all the shortfalls of the healthcare system really kind of were showing up in that emergency room. And it really struck me. This is the problem in the system, and it's so prevalent. It's so extreme in California. It's true, of course, across the country, but it's so true in California where there's so much wealth and so much poverty at the same time. And
those, you mentioned preventable diseases. I mean, if my idea is that if you take a population base and you set up a certified patient-centered medical home, which has the primary care, it has at least a social worker or a mental health person tied into that clinic. The social worker can work on the social determinants of health, so that you give that person comprehensive preventive care, then hopefully they won't be in the emergency room. I worked for an outfit once and they chewed me out because I wasn't seeing enough patient, I should have been seeing 500 patients a month instead of 400. And I said, well, if I spend extra time with them and that helps keep them out of the hospital or in the emergency room, isn't that a good thing? Then I realized, no, they make more money when my patient ends up in the emergency room in the hospital. So they weren't allowing me to do my job to work on preventive care. And that's one reason I left them.
that's such a good point. Thank you for that. I really would like to, if you don't mind putting your phone number in the chat, I would like to follow up with you. But I think I'll just say one more thing. I think the problem really does come down to low reimbursement rates in terms of, especially the Medi-Cal population. I mean, we have over 14 million Californians, over a third of Californians are on Medi-Cal. So you can't ignore this population. The reimbursement rates are paltry, and even doctors who do see Medi-Cal patients, it's like a sliver of, it's like 5 or 10% of their patient population. So there isn't enough providers. And if you really want to fix the system, I have heard this loud and clear, and I'm convinced from looking at data and talking from like doctors on the ground, like if you want to improve it, you really have to try to reform the Medi-Cal payment rate system. The state isn't even going to look at that right now. We're looking at some budget deficits. So we shall see.
Super, thank you. Well, I put my number in there. Like I say, I'm no expert, but just
Thank
from
you.
my 40 years of experience, that's the conclusions I've come to.
Great. Yeah, no, thanks for that, Jim. Really appreciate it. And Norby.
Good morning. My apologies. Excuse me. Give me just a second, thanks. My apologies for tuning in just a little late.
Oh, not at all.
First, as many of you know, I suffer from stage 4 kidney disease. So I go to dialysis 3 or 4 days a week. And I would like, next time you see your colleague, Rachel Bluth.
Yeah.
Yes, please thank her. She did an extensive article talking about my experience as a dialysis patient during the last election cycle over the kidney disease, the Prop 29, the No campaign. And I got so many comments from many of my friends who saw the news feed all over the place.
Oh, good.
Like 15 minutes of claim to fame, I guess. So on a more serious note, my question is, now that the Republicans have taken the House of Representatives and Kevin McCarthy will most likely be the next speaker, what impact will that have, with those who are, as Governor Newsom has been trying to do, provide health care for undocumented individuals?
Good question. sorry, Norby, repeat that last part you said.
Sure. What impact as McCarthy becomes speaker and we see the Governor Newsom, as you talked about it briefly, is trying to provide health care to undocumented individuals? What do you see could happen that would endanger that type of health care?
In California, so okay, good. That's a great question. I have two thoughts about that. So, and you talked about Newsom being like a leader. I think that the expansion to undocumented immigrants in California, like relatively early, and he has promised to serve the next 4 years as governor. So, like, I think that's going to be really important to have those 4 years of experience for him, because if he does run for president, and regardless, he's making a name for himself even more on the national stage. He's gaining more and more popularity within the party. And even like the politics of Congress, right? The headwind shift back and forth. I mean, Democrats have the Senate now, and I think we're going to see a lot of gridlock. But I think no question we're going to see, as Newsom sort of becomes more and more present nationally, they're going to see fights with the national party on some of these issues. We're going to see attacks coming at him. So the first point I'll make is those first 4 years of experience are going to be really important. If Newsom can point to the expansion and say, look at how much money we've saved, or look how many people have gotten care, or look how great California is doing, right? He loves to talk about how great California is doing. So that's the first point. Like statewide, I don't see that in peril at all. He has strongly defended the expansion, and I think the only thing that I kind of question and would watch is like state finances. If the state economy takes a downturn and revenues tank, there's going to be, something's got to give, right? I don't know if it's the expansion or specific benefits that have been expanded or other areas of government that take cuts, but something's got to give there. So that's just something that's down the road. Nationally, I think we're going to see this issue of covering undocs take the national stage, especially as the presidential campaign now gets underway. We'll see what happens if Democrats start jockeying, or if Biden, he said he's going to run, he intends to run. We'll see what happens with that. But if there is a primary contest, we will see this issue come to the fore again, and California will be in the spotlight. So then, like the McCarthys of the world and all the, there's going to be they're going to come after California and Newsom particularly. So I think there's a lot of like defense mechanisms and stuff that the state needs to like start working on if politically, if they're going to like rebuff some of those attacks. I don't think that this like nationally, like the expansion is like a non-starter. There's still states that haven't expanded Medi-Cal under the ACA to like the childless adult population. So this is like, I would say, a non-starter nationally.
Okay, thank you very much.
Thanks, Norby. And and it was great to see your photo in the article that ran too. So, and Mildred, take it away. And I think this is going to have to be our last question. I have so many questions I want to ask too, but we should probably wrap up. So Mildred, take it away.
Right. I was just going to say there's so many questions and long discussion, like you had said, Kate. And I wanted to compliment Angela for her work also, and how important it has been that we are seeing these kinds of discussions now in the media. Even public radio is commenting some about it. And one of the things that maybe I'm making more of a comment than a question, but some of the comment is related to the Governor's Commission. And we need to remember that one of the determinants of social health is the access to health care. Yeah. And if you can't pay for it, or if you have inadequate insurance that's not going to cover things, and people are making a decision, do I go get this checked out, or do I buy food on the table? They ignore that. And the commission found that the Affordable Care Act and our current, and I wouldn't even honor it with the system, but the current situation is that we have more problems rather than less. And it has not saved money. It has not stopped the bankruptcy. And my concern is with the governor continuing on and expanding those, that we are only compounding the problem, and he will not get the result that he wants with showing outcomes better for California. And he has also said at one time that he learned, putting more money into something isn't the answer. You need to go with evidence-based practice. And there's many things that we know work. And if we don't fund our workforce development, fund public health, and use the evidence that's there on what works, and there's lots of evidence for the single payer, that the commission looked at, but they did not, the pressure was such, I don't know why, the outcome, that they did not come out strongly with that recommendation. But I don't know if you had any thoughts about the results of the commission.
The Healthy California for All Commission.
Yes.
Mildred? Yeah. So, John, I think you said that. I think it is politically, it was a way to shift, to sort of satisfy that promise and to take, say, look, we're exploring it. We asked the federal government for a waiver. That doesn't, doesn't mean anything. The process in and of itself, though, was so interesting because you got to hear people like William Shao. He's like such right? Isn't he he's such like a nonpartisan expert. He really doesn't take one, but the evidence like provided and the data provided through through those reports and through the commission is like so helpful for like looking at the system and where the funding problems are, and where like if there is a transformation in the future, like that I think is foundational, because the way that the commission and those reports were produced, I think was apolitical. So I feel that that's really interesting and of value. And there was like a lot of, there was good tension and drama with like the single payer, California Medical Association, there's a lot of like sparks too. So that's all really cool. I think the advocacy community is going to keep pushing. Newsom is going to be able to hold them off by even having that commission. So like, I think politically it's a win for him, to be honest, because it works for the messaging. He can say, look, we're not only we looked into it, he can say we're looking into it. And they're really careful not to call it single payer, right? Unified financing. Look at Medi-Cal, you guys. Medi-Cal is going to be almost entirely managed care in the next 4 years, like 90%, 99 or something % managed care. Isn't that a form of unified financing? Just think about that. That's something I think about. What is the state nibbling around the edges on? How is the governor gonna spin this, right? And he doesn't say that this is over. He talks about it like California's looking at this, right? The commission did its work. Nothing they did was binding. Now it's in the governor's hands to make a decision on something. So as we see another single payer bill come in the new legislative session that starts in January, and I think we will, if not this year, those 2-year sessions, right? So I think we'll see it, if not this year, the following, to push him. He's going to have to figure out how to address that. And I just think about Medi-Cal and if there's something he can say there. I'm not sure, but it's something I'm thinking about.
It's not universal care because it's not single payer. It's too complicated. Every time they add something on, it makes it worse for everybody. That's where we are. The health professionals are leaving the field because the insurance industry is running the industry. Thank you for an excellent talk.
I mean, you're welcome. Yeah, the provider shortage is
you spend half your time doing prior authorizations for the managed care people. It's a pain.
Yeah. Well, thank you guys so much for having me, and really feel free to email me. I'm interested in just your thoughts about anything and your questions and what you think we need to be, what should I pay more attention to and write about? I want to hear from you. So feel free to email me.
Great. Angela, thank you so much. Really appreciate it. This was a fantastic presentation and just really terrific.
Yeah, of course. You guys have a great weekend.
Thank you. You too.
Thank you so much.